Belle Samuels Thoms co-founded the National Association of Colored Graduate Nurses. As a Black nurse, I admire her commitment to establishing an organization for African American nurses. Her work helped nurses of color gain leadership skills and achieve higher professional standards. For me, being a nurse goes back to how I grew up. When my family did not have access to health care, it was too expensive, and we didn't have anybody who was a doctor or a nurse in my hometown. So I understand what it means to be sick and not have access to a doctor or a nurse. And when I had the chance to get an education, I decided I wanted to be a nurse. The hardest part of last year was watching what COVID did, not only to patients, but what it did to my colleagues, to other nurses. They were exhausted. They pushed themselves to the limit, or there were no limits. They just pushed themselves to the point where they just cried. They had nothing left, and still they continued to give. When I think about talking with my family and answering email and phone calls from colleagues who were working in the community, and the Black community in particular, pulling together as a community to address things that were not being written about in the headlines because we were early on in the process. I am so proud of how the community gathered itself to take care of itself, and included in those efforts were doctors and nurses. I decided to get my shot in early March. For me, it was about not being a risk to people I cared about. I wanted to be sure that if I went out and about, that there was no risk. I did not present a risk to anybody else. I did not want to be that person who was a carrier. I didn't want to be that person who was putting anybody else in danger. So the way the process typically works, I'm sitting down chatting, and I'm asking questions around what have you heard? What are your concerns? Where are you getting your information? Sort of let people honestly share. I stay away from pushing. I stay away from making a person feel foolish for asking questions. And if it takes more than one conversation, I'm open to whoever makes that phone call or sends that text message or sends the email about additional questions. Taking the vaccine is something that a person has to work their way through in terms of reasons for deciding to take it.